Hi, I'm Carolina Giansenci, and I'm here to share a little bit of my experience at CSM. I went to a lecture called Two Poops to Play, Constipation and the Effect on Global Development in Young Children. The lecture was presented by Sarah Cooper, Caroline Berg, and Marla Gropper. They're all PTs from Children's Hospital of Philadelphia. So here I'm going to outline the most impactful learnings from the class. So the impact of constipation in the US, 5% of sick visits to pediatricians in the US are due to constipation, which causes a burden on the healthcare system of $5.9 billion. There's also a big impact on the family unit. So we have monetary issues with healthcare visits being expensive and also the cost of additional supplies and medication. There's a time issue here because parents often have to miss work to take the children to the doctor, and also we have children missing school. There's a big emotional component because of the burden on the caregiver. Also might lead to strain on family relationships and causes changes in behavior and emotional wellness. And there's a big social component as well because of bullying and social isolation, especially as the kid grows, and they might experience fear of being dirty in school, or if they develop incontinence, they might not feel that they're smelly, and then other kids might bully them. So the long-term impact of constipation is that children with constipation become adults with constipation. So adults with functional childhood constipation are more likely to have IBS later. 1/3 of children with constipation become adults with constipation even after treatment, and heart stools in early childhood are strongly associated with constipation later in life. So this image I got from the lecture, like the original lecture from CSM. I thought it was a very good image, so I put it here. This outlines functional gastrointestinal disorders. So as you can see, it's a cycle. So I'm gonna start with the top left. So we have the hardening of stool. So that increases the difficulty in voiding the stool, which leads to pain, which leads for the kid to start holding onto the stool, which increases absorption of water from rectum, which hardens the stool, and then you start the cycle all over again. And then we have the rectum becomes enlarged. There's overflow incontinence, impaired rectal sensation, loss of urge to defecate, impaction, and complete emptying. So 3 important life stages that we should pay attention to because that's when kids have a higher likelihood of developing constipation are at 6 months old, when they start to eat solids, then 3 to 4 years old, because that's when they start toilet learning. And up to that point, the child was not restricted on when, how, and where they could poop, and now you're trying to limit that. So you're telling them when and how and where, so that can lead to constipation. And then by 5 years old, they start participating in school. So now they are moving to a different environment. So maybe up to then, the child only pooped at their house in the bathroom that they are used to, and now they are having to poop in school. So they're not comfortable with that different bathroom, the different toilet. So that also can lead to constipation. In children with special needs, we see that 25 to 50% of children with intellectual disabilities have constipation, and 26 to 74% of children with physical disabilities have constipation. Some diagnoses that they went in depth in the lecture or trisomy of the 21, CP, spina bifida, joint hypermobility, and autism. They also pointed out some risk factors for us to pay attention to when we're taking history, which are if the kid was breastfed for more than 6 months, also the health literacy of the family, socioeconomic status, low birth weight, prematurity, and developmental delay. So here I highlighted what I thought were the most important points from the impact on development. For growth, there's low weight and height due to low appetite and food selectivity, and also lower quality of sleep. For behavior, we have poor tolerance to positioning and handling due to discomfort, decreased participation in explorative play. For learning, we have lack of participation and focus in school, and also missed school days due to clean outs, discomfort, and fear of being dirty. For gross motor development, we have poor tolerance to positions that compress the abdominal cavity, difficulty with independent transitions, positional preference, decreased coordination of upper and lower extremities with trunk flexion, decreased endurance, and general malaise. So we have some strategies to improve bowel and bladder health. So the first thing you can do is use breath strategies. So blowing cotton balls, whistles, or megaphones. You should also normalize defecation and urination. There are books that you can use to teach children about bathroom learning, sensation, and constipation. You should also encourage play in different positions for positional tolerance, engage in movements like reaching while seated to improve coordination and abdominal muscle engagement. And there are also massage techniques that you can use. So here in this slide, I put the I love you technique because of the way that you massage the belly. But there are other techniques. And then something that I thought was very interesting is that there are ongoing studies on TENS to see if we can use TENS to improve bowel movements. So how might this topic impact my future practice? I'm not sure if I'm going into pediatrics, but if I do, then so many children have constipation that it will be imperative for me to know the signs, the symptoms, and how it affects development so I can treat my patients to the best of my ability. And also addressing this problem can decrease the family burden and also the burden on the US healthcare system. And even if I'm working with adults, we know that children with constipation become adults with constipation. And they have a higher likelihood of having IBS and also emotional and social issues that come from childhood constipation can be carried over to adulthood. So um, understanding the patient's history will help me get better outcomes even when I treat adults. So from the exhibit hall, I found this piece of technology called Puma from Enlighten. And it is basically a harness that they have in both pediatric and adult sizes. So this video is me trying the adult size one. And it provides mobility support for children. It can help children with disabilities to become more mobile and engage in exploratory play, improving bowel function. So what I thought was very cool about this technology is that it provides as much support as you need. So you can set it up to provide more or less support. But it doesn't restrict you in any way. So you can do and like move around and play. So that movement and being able to have kids with diagnoses like CP and maybe spinal cord injuries, making sure that they are weight bearing and moving out of those preferred positions will improve their bowel movement and we'll make sure that they don't have constipation. Thank you.